Let's have a discussion on the bone infections now. Infections in the bone can be categorized into two. One is pyogenic infection, other one is tubercular infections. As far as pyogenic infections are concerned, it is further categorized into acute osteomyelitis, chronic osteomyelitis, then subacute varieties. And tuberculosis is going to be a regional discussion of tuberculosis, like tuberculosis of spine, tuberculosis of hip joint, tuberculosis of the knee. All right. So all those relevant topics are going to be covered under this particular section. So before we start with the first topic in bone infections, let's have a discussion on the question, or you should be introduced to the question first. And the question is that a 5-year-old male brought to OPD 5 days after sustaining injury to his right knee. Now, although we are talking about an infection, but the history of injury is given as a first segment of the question. All right. So after sustaining injury to his right knee, so history of injury is there. On examination, there was swelling, there was limitation of movement, there was fever. So there was a swelling, limitation of movement as well as fever. Now, swelling, limitation of movement could be a feature in case of fractures also. But when you see the word fever to be presented in your question, then possibly the examiner is asking about infections. And X-ray shows no bony fracture. So obviously there is no bony fracture which is visible on the X-ray. So particularly you are talking about a infection. Then what is the significance of this injury to be kept in your question? It is going to be discussed later. So at this point of time, you just were introduced to this question, and now we can start with the first topic, that is acute osteomyelitis. Now, before we start writing anything related to this topic, first of all, let's have a discussion of the heading itself. Acute means of immediate onset. Osteo means bones. Myelitis is the infection of the bone. So it is the immediate infection of the bone, short term or short duration infection of the bone. Now, what is the most common age to be affected? It is particularly common in case of children. Although any age could be affected, but it is far, far more common in case of children. So if I say that a child in the age group of around 5 years, 7 years, 8 years, likewise, it is more far common in these cases as compared to adults. All right. Now, why is it more common in case of children? You will come to know after some duration of time. Next is, what is the most commonly affected bone by this infection? Now, as far as children are concerned, in case of a child, the most common bone to be affected is distal femur and proximal tibia. All right. So these are the most common site to be affected in case of a child. While in case of adults, the most common bone to be affected is a vertebral column, that is spine. All right. So vertebral column is the most common site in case of adults, while in case of children, it is distal femur, proximal tibia are the most common site. Next. Now, what is the most common site to be affected in a single bone? You see, now in a bone, as you already are aware of the fact that there are multiple segments inside a single bone. Now, if we talk about those segments, let's have a discussion on, for example, if this is a bone of the child we are discussing, so it would be having metaphysis, epiphysis and a diaphysial region. So it is epiphysial region. You already are aware of this. We have already discussed this when we were talking about the introduction or introductory part. Then this is the metaphysial region. And finally, it is the diaphysial region. Similarly, we are having a distal metaphysis and distal epiphysis also. So out of these multiple regions of the bone, the most common site to be affected by this infections is the metaphysial region. So metaphysis is considered to be the most common site to be affected. Now, there are reasons for that why metaphysis is considered to be the most common site, or why metaphysis is more commonly affected. The reasons could be divided into 3 categories. The first reason obviously is the vascularity. All of you are aware of the fact that, out of epiphysis, diaphysis and metaphysial region, the metaphysial region is cancellous region of the bone. Because it is cancellous region, so it is more vascular because it is having lesser density. So per unit area of the bone in the metaphysial region is more vascular. Now, all of you have heard about the word blood agar or the chocolate agar. These are the culture media for the growth of the organism, and the nutrient in that culture media is blood. That means blood is favoring the growth of the organism. So wherever in the bone the region is more vascular, it is more likely to be affected by infections. All right. So that is one reason, vascularity, increased vascularity. Second reason is a hairpin loop arrangement of the blood vessels. That is hairpin loop blood vessels. Now, what do you mean by the term hairpin loop vessels? You see, the blood vessels can be categorized into 2. or blood vessels are of two types or could be of two types. One is a straighter vessel. This is blood vessel A, for example. And the other one is tortuous blood vessel. This is blood vessel B, for example. All right. Now, the velocity of the blood flow obviously is going to be more in a vessel A is in comparison to the velocity of the blood flow in vessel B. So, velocity of the blood flow in vessel A is going to be more in comparison to the velocity of the blood flow in vessel B because of the Poiseuille equation or Poiseuille theorem that you might have studied in mathematics. Obviously, just use your common sense. You will find that if the road is tortuous, then the velocity of your car will be slower. While if the road is straight, then the velocity of your car will be greater. All right. Now, imagine if both these two vessels are infected with the same organism in the same magnitude. For example, if this is the organism which is present in this blood vessel and the same organism in the same concentration is present in this vessel. Now, because of the rapid blood flow, this organism will be easily washed away. It is not going to be static. While because of the sluggish blood flow, the possibility of this organism to become static in this tortuous blood vessel is higher. So that is the reason. This is a factor or a contributory factor that why acute osteomyelitis are particularly affecting the metaphyseal region, because the metaphyseal blood vessels are hairpin looped blood vessels. They are tortuous blood vessels. They are not straight blood vessels. All right. So that was the second reason. And as far as third reason is concerned, it is because of the inefficiency or ineffectiveness of the reticuloendothelial system. So ineffective reticuloendothelial system. So these are the three reasons combined. The metaphysis is more common site or most common site to be affected by acute osteomyelitis. All right. So if we go back to the theoretical part, that most common site in a bone, which one of the following is the most common site in a bone to be affected by them? Answer for that question is metaphysis. And you came to know that why metaphysis is the most common site. It is because of the increased vascularity. It is because of the arrangement of the blood vessels, and it is because of the ineffectiveness of the reticuloendothelial systems. All right. So that was about the introductory part of the acute osteomyelitis. Next, what is the most common organism which is isolated from acute osteomyelitis, or what is the most common organism which is responsible for causing this acute osteomyelitis? So in 90% of the cases, what you get is Staph aureus. All right. The most common organism for causing acute osteomyelitis or isolated organism from acute osteomyelitic lesion is Staphylococcus aureus. All right. The most common organism. But you know, in case of sickle cell disease, because of unknown reason, if the patient is having a sickle cell disease and he is suffering from acute osteomyelitis because of unknown reason, Salmonella is also very commonly isolated. All right. Therefore, whenever you are going for the empirical management of this condition, the drugs against Salmonella infection should also be given to the patient. Hope you have understood the concept behind. So in sickle cell disease, Salmonella, because of unknown reason, is also considered to be the common organism. Otherwise, the most common organism isolated is the Staphylococcus aureus. Now, coming on to the clinical features. Now, at this point of time, you very easily can tabulate what all are going to be the clinical features for acute osteomyelitis. Imagine a patient who is having a infection in the metaphyseal region surrounding the bone, leading to the formation of the abscess. Then what all will be present? First of all, there will be a history of injury. There will be a history of injury. Now, although this injury might not be a major contributory factor for this infection to develop, but the parents who are coming with the child who is having infection will always give you a history of injury prior to the course of disease. Although this history of injury is not significant because it is not a contributory factor for this condition, or might be a lesser contributory factor, but history of injury will always be present. All right. So if in a question you get this history of injury, like a sample question that I gave you in the beginning of the lecture, that a 5-year-old male brought to OPD 5 days after sustaining injury. Now, although this injury has got nothing to do because there is no fracture, there is no soft tissue injury, this injury history will always be provided to you because practically the parents will always give you a history of injury, despite the fact it is considered to be insignificant related to this condition. All right. So history of injury will always be present, and don't consider it to be a misleading concept which is provided to you in the question, or misleading content which is provided to you in the question. So history of injury will always be present. Then next, there will be pain. Obviously, there will be tenderness. There will be limitation of movement. All right. When you try to move it, then the child will start crying because of the collection of the abscess, and there will be swelling. So all these features would be present if a patient coming to you with the acute osteomyelitis for that particular limb. Now, all these clinical features are also similar in case of fractures also. Like in case of fracture, there will be pain, there will be tenderness, there will be abnormal mobility also, but here there will be limitation of movement and there will be swelling. But one feature which is very importantly highlighted is a presence of fever or a history of fever. All right, the patient will be having a fever because the patient is suffering from infection. So these are the clinical features which you have to think about. Although these clinical features are not exactly going in the direction that you will make the diagnosis of osteomyelitis, but if all these clinical features are also having fever in its content, then possibly the examiner is asking about infections, because fever will always be present. All right. So based on these clinical features, you came to know that possibly the patient is suffering from infection of the bone. Then what you will go for? You will go for the laboratory findings. That means you will go for the blood investigations. Now, in that laboratory finding, what you will get? One point is that there will be raised total leukocyte count. Now, all of you are aware of the fact that 4 to 11,000 is the normal leukocyte count. But in case of acute osteomyelitis, there will be a raised TLC, and because the condition is acute, means it is not chronic, it is of less duration, then there has to be raised neutrophil count also. All right. So there will be neutrophilia. Neutrophilia in the sense that there will be, if you go for the differential leukocyte count, then there will be raised polymorphonucleocytosis, raised neutrophil count. Then, because it is an acute event, it is also inviting the inflammatory processes. There will be raised ESR, erythrocyte sedimentation rate, and raised CRP. So these are the laboratory findings. When you see the patient in the emergency or in the OPD, you are suspecting him to be suffering from infection. You go with the clinical features, you go with the laboratory findings. So these are the laboratory findings. What next? Then you will have to go for the radiological investigations. That means the X-rays. Now, as far as X-rays are concerned, there are two typical findings that you have to focus on, particularly in case of X-rays. The X-ray finding for acute osteomyelitis. The first one, which is considered to be the earliest X-ray finding, which is obviously not the diagnostic X-ray finding, which is just suggestive X-ray finding, is that there will be an obliteration or you can say loss of soft tissue planes. All right, there will be an obliteration or there will be a loss of soft tissue plane. Now, what do you mean by this statement in particular? For example, when you see a bone, imagine this is a bone, all right, and we are having a bone which is covered by the soft tissue. So this is the presence of the soft tissue. So here we are having a deep muscle, and then we are having a superficial muscle, and in between the two there will be a plane of separation, which is very clearly evident on the X-rays. There will be a plane of separation. When you move your eye from bone, all right, when you move your eye from bone to the soft tissue, then from this deep soft tissue to the superficial soft tissue, you feel that all of them are being compartmentalized. There is a plane of separation. Now, if there is a collection of the abscess in these regions, imagine if this region is having an abscess, then all these soft tissue planes would be obliterated. You cannot see those soft tissue planes or the clear-cut demarcating planes. All right. So that is considered to be the earliest X-ray finding, which is obviously not suggestive of that the patient could be suffering from acute osteomyelitis. Now, what is more important X-ray finding is that there will be a periosteal reaction or elevation. All right. Actually, it is a periosteal reaction which leads to elevation, but it will take some time for its appearance. That means the first appearance of this X-ray finding, it will take at around 7 to 10 days after the infection. All right. It is not like that today the patient developed acute osteomyelitis and tomorrow there will be a periosteal reaction along with the elevation visualized on the X-rays. It will take at least 7 to 10 days for its appearance.